Yeah, my name is Luca Guardabassi, and I have actually a double affiliation. I'm professor in antimicrobial resistance and antibiotics at the University of Copenhagen. And recently I have actually relocated to Ross University School of Veterinary Medicine in St. Kitts Nevis, where I have also professorship in clinical microbiology.
It's interesting because antibiotics, antimicrobial resistance it's a global issue. We've got President Obama, presidents from out the world talking about it. You are in two institutions, but I mean, what does it mean? What does it mean for you personally, Luca?
Well, personally, it means a lot because one of the professorship is fully dedicated to antimicrobial resistance, so I'm a little bit biased in this respect. But obviously, it is a global public health issue. Everyone talks about this problem right now. It remains to be actually assessed, determined what is the contribution of veterinary use of antimicrobials on antibiotic resistance problems in humans. So there is no doubt that antibiotic resistance is a problem. What is more controversial is what is the contribution from the animal sector to resistance problems in human medicine.
And I mean, obviously, you feel sufficiently motivated to, and we're very glad to have you on board, to give up some of your time to this GRAM initiative. When we look at it and we survey veterinarians in Europe, despite the sort of wealth of advice, this wave of science and quasi-science around the subject, there still seems to be a need to have good, strong, practical advice. If you've been working today on the subject, but in 5 years' time, looking back, what do you think you'll be most proud of if GRAM could deliver that?
Well, I hope that this initiative, as other initiatives in the area of antimicrobial stewardship, will contribute to a more prudent and rational use of antimicrobials among veterinarians. So we need to reduce the use and also choose the most appropriate drugs depending on the specific conditions of the patient and the specific infection and so on. So we will see if there is an impact by looking at data on consumption, but for example, there are no data available on consumption of antimicrobial agents in companion animals. So there are a lot of knowledge gaps that we actually face also during the preparation of these guidelines, because there have been discussions within the group on specific topic where there are no data available, and then it's also difficult to take a decision on how to guide veterinarians to the most correct antimicrobial choice. So I think the exercise is to guide veterinarians to rational use of antimicrobials, but for us is also an excellent exercise to identify knowledge gaps that have to be filled in the future.
We also see that when the public is surveyed, there are strong misconceptions about antimicrobial resistance. There's a lot of fear about antimicrobial resistance. In many ways, you can argue that the veterinarian has almost been bypassed in his role as a professional at the center of the prescription process. How do you think we can put veterinarians back at the center of a rational prescription process and restore the confidence of pet owners?
Well, it has a lot to do with education. I don't think that the current education in veterinary medicine, at least I'm talking general now, in most vet school in Europe, sufficiently covers this area, how to prescribe antimicrobials. So we need probably to improve education at the university level and have also activities arranged, ongoing education activities, continuing education activities that can be used to increase and improve the knowledge of veterinarians on what antibiotics are, when they should be used, and how they should be used.
Looking at, last question, I mean, looking ahead at the future, very broad question, but I mean, you're right at the center of it. What do you believe the future of antibiotherapy should be?
Well, this is a very interesting question to me because it's one of my main research interests. Well, I think that there is, of course, need for new antimicrobials for specific types of infections, but I think it's even more important that we learn how to use rationally the antimicrobials we know. Because, as I mentioned before, there are still many knowledge gaps regarding dosage, duration of treatment, and so on. So I think we need we need research to rationalize the use of the antibiotics we know. Of course, on the top of that, there should be also research in the antimicrobial drug discovery side. And with specific reference to the veterinary world, I think there is a need to develop antibiotics or non-antibiotic methods that target specifically veterinary pathogens without contributing to development of antibiotic resistance in human medicine. That would be a great achievement.
Just maybe a personal question. For the last few years I've been the chairman of the communication committee for the International Federation of Animal Health. Mm-hmm. And we've often wondered, should we talk, should we not talk in public? And in many ways, we haven't spoken, and I think about it in terms of Graham and Siva. I think we talked about being a facilitator. What do you think that pharmaceutical companies really have a role to play, and what should Graham do, and what should Graham not do as a program?
Well, of course, pharmaceutical companies should play their role. Nobody should be excluded from this discussion. Also because there is a lot of knowledge within the pharmaceutical companies, which is actually in some cases not even available to people like me working in the public sector. So I have no doubts that there should be collaboration between academia and pharmaceutical industry. And the diagnostic industry, so the animal health industry in general, should be involved because rational use of antibiotics has also a lot to do with diagnostic tests. For example, I think the future is more, there will be future for in situ diagnostic tests, that is so-called point of care testing. That would be extremely beneficial for veterinarians to take quick decisions on whether an antibiotic should be used or not, and or which type of antibiotic should be used. So definitely yes, the industry should play a major role in this kind of debate that has started.